On March 17, 1868, 12 Sacramento physicians gathered together in hopes of forming an alliance. They had survived a cholera epidemic, witnessed their city become the capital of California, and knew that Sacramento needed strong leadership. This was the birth of the Sierra Sacramento Valley Medical Society 150 years ago.
Those physicians back then really had tremendous struggles they faced. This was before the time of aseptic surgery, and of course there was tremendous amount of ignorance about how disease was caused or spread. Physicians unfortunately did not have much to offer their patients other than their compassion and their care.
They were obviously extremely dedicated.
As the science of modern medicine had yet to be developed, SSVMS physicians knew the greatest impact they could have was through public health leadership. These founding members, and those who followed, became civic leaders taking on roles such as the director of the State Board of Health, the president of the Board of Education, and the Secretary of State for California. 17 SSVMS members have gone on to be president of the California Medical Association. 3 members became president of the American Medical Association, 1 member a state senator, and another a member of Congress. This rich history is preserved in the Museum of Medical History, which attracts more than 1,500 visitors to the SSVMS offices each year. Guests are transported back in time as they see carefully curated artifacts from the fields of surgery, pharmacy, medical quackery, and the museum's prized iron lung. The museum hardly scratches the surface of all that the SSVMS is or does. In 1947, members recognized that a community-based blood bank would serve our community better than individual banks within each hospital. That idea grew into Blood Source, one of the premier blood centers and research organizations in the world. The SSVMS believes in the future of medicine, and in 1967, using funds left over from the polio vaccine program, created the Medical Student Scholarship Fund. To date, more than $275,000 have been given to medical students who graduated from a high school in the Sacramento region.
For me, SSVMS has opened up a lot of doors, which has been really invaluable to me as I go forward into my career.
Always looking for ways to serve its community, SSVMS's Spirit program is sending volunteer physicians into the community, offering free care for those in need. Since 1995, physicians have given more than $10 million in free care, treated over 50,000 patients, and performed over 1,000 surgeries.
This has been a great way for our physicians to give back and for us to strengthen our community and to demonstrate really the key sentiment that drove most of us into medicine to begin with, that of helping others.
Whether it was creating the Smart Medical Clearance Protocol to help emergency departments better care for patients in mental health crisis, or collaborating with community members and experts to prevent opioid misuse as part of the RX Safe Physicians Program, the SSVMS and its members are making Sacramento a safer and healthier community. And the SSVMS is also looking after its members.
The Medical Society serves a very useful role. It's an opportunity to bring together the minds of physicians all over the community and to come up with solutions.
It helps physicians in all kinds of practices.
I literally couldn't survive in practice without my medical society.
The Medical Society to me is a community organization. People who don't have a voice in this community can get a physician, kind of partner with them. You know, people stand up and listen to us, and so we have a lot of power that way, and that we can do a lot of good and help. So I think that's why it's important for us to be here.
It's taking care of physicians so that they can take care of patients. Our focus is on bringing together physicians from all specialties and all modes of practice to address the art and the science of medicine, but also to take care of the physical and the mental health of our entire community.
Medicine is very different than it was 150 years ago. Modern medical science, advanced communication, and medical record keeping offer both advancement and challenges for physicians. Rates of physician burnout are on the rise, and the need for support and camaraderie are just as important now as they were so many years ago. Addressing these needs are at the very core of the Sierra-Sacramento Valley Medical Society. They call this effort the Joy of Medicine.
Physician burnout is certainly something that is very concerning and a challenge for the profession, but in many ways, the answer to that is actually our medical society.
This is something that is saving doctors' lives.
It means coming together regularly, talking about issues faced by physicians and citizens alike, and looking for the very best way to serve the people of our region.
We're really bringing back collegiality and the joy of practicing medicine.
For 150 consecutive years, the Sierra-Sacramento Valley Medical Society has proudly served physicians and patients, addressing issues that not only afflict the Sacramento region, but also California and the world.
We have to remember that medicine is a caring profession, a lot of humanity, a sprinkle of science. That's the entire basis of what we do and who we are.
With an unprecedented 1,500 new members in the previous 5 years, the SSVMS is on the rise and looking to continue its leadership for years to come.
We're not just surviving, but we are thriving. We are growing, we are healthy, we are representing our physicians, and congratulations, a job well done. The present success builds upon the efforts of many generations of physicians and administrators before us. We owe a debt to all.
Whenever we needed you, you were there. The staff has been kind to us, supportive of our greater mission, and you were always there to help us, to keep us together and moving forward.
Congratulations, SSVMS, on 150 years. It's an amazing accomplishment.
Well, congratulations, Sierra-Sacramento Valley Medical Society. It's been a great 150 years, and I look forward to another 150 years.
I couldn't have done it without you, and I'm so very proud to be part of this family.
Congratulations on 150 years. That's an amazing feat. We are one of the oldest medical societies, if not the oldest, and it's truly amazing.